Dementia and Alzheimer's disease are among those conditions that most people know very little about. Yet everyone is afraid of them. We are used to thinking that this disease only appears in old age, and its cause is unclear. But in reality, there are different types of this condition. It can appear not only in old age, but even in younger adults, and they are not a natural or inevitable part of aging. If you or someone in your family starts showing some symptoms and a doctor tells you, well, what do you expect? That's just old age? That's not a good thing. You go to a doctor to have your condition treated, not to have someone guess your age by looking at you. Watch this video till the end. There will be a short test at the end of the video to help you check yourself for early signs of dementia. All you'll need is a pen and a piece of paper. The word dementia literally means without mind. D for without and mentia for mind. It describes a syndrome, not a single disease, a set of symptoms caused by the gradual loss of the brain's core functions, thinking, memory, attention, speech, or movement control. Dementia can be triggered by many different conditions. The most common form is Alzheimer's dementia, but there is also vascular dementia, which develops as a result of multiple strokes, heart attacks, or atherosclerosis of the brain's blood vessels. There is also alcohol dementia caused by chronic alcohol intoxication. Some dementias can arise from inflammatory processes, such as, for example, chronic urinary infections, autoimmune inflammation, or even HIV-related inflammation. In all these cases, the underlying mechanism is essentially the same. Neurons, the brain's nerve cells, die off. And the more neurons die, the more brain functions are lost. In each type of dementia, the symptoms can look a little bit different. But since Alzheimer's dementia is the most common form, that's why we'll mainly focus on it. Even though scientists have been studying Alzheimer's disease for over a century, we still don't fully understand it. Every year, around 10 million people are newly diagnosed. Right now, there are over 50 million people living with dementia worldwide. And by 2050, that number is expected to triple to 150 million. In that case, it would be better for us all to know what symptoms this disease starts with. In the early stages, the first sign is unusual forgetfulness, the kind that's not typical for the person. If you've always been a bit distracted, that doesn't count as Alzheimer's. You've always been like that. Even if you sometimes forget where you put your keys or lose your gloves all the time, that's fine. But still, don't forget to subscribe to my channel and hit the bell icon so you don't miss the next videos. In people with Alzheimer's, though, memory problems go beyond ordinary forgetfulness. They forget where they put things, miss appointments, or forget about upcoming events. They can even get lost in places they know well. For example, go out to the same grocery store they've visited for years and suddenly can't find their way there. They may also start to lose their sense of time. If you just recognized a few of these symptoms in yourself, don't panic. All of that occasionally happens to me too, and I don't have dementia. I'm just naturally a bit forgetful. But if these behaviors are new for you or for your loved one, if someone suddenly starts forgetting things or acting differently, that's when it's time to pay attention. In the second stage of dementia, forgetfulness gets worse. A person might put things in strange places like a phone into the oven and then be convinced someone stole them. Once they believe that, it's very hard to convince them otherwise. They might get confused even inside their own home, mixing up rooms or forgetting where things are. Communication becomes harder. They might become withdrawn, quiet, or they don't want to talk. Some people start pacing with no aim in the room or asking the same question over and over again because they've forgotten the answer. They begin to neglect personal hygiene. They may stop caring about taking a shower or do their hair. In the third and most hard stage, a person loses orientation completely. They no longer recognize where they are, who they are, or who's around them. They can't recognize family or friends. They stop taking care of themselves, may have trouble walking or even refuse to move at all. Behavioral changes are common. They can become extremely emotional, irritable, or even aggressive, saying some rude things they never would have said before, or even start to swear. Their emotions can shift suddenly from laughter to tears, from calmness to anger, so-called emotional swings. Movement disorders can also appear. These changes often affect speech and fine motor skill first. Since speech is also a form of movement, it becomes unclear A person cannot finish the phrase because he can't find the words. Fine motor control also impairs. Writing or drawing become difficult or impossible, and even simple tasks like holding fork or buttoning clothes require great effort. Naturally, the person can no longer care for himself and needs assistance. In some cases, tremors, muscle spasms, or even seizures may develop. But even if you notice any of these symptoms in yourself or your loved ones, this does not necessarily mean dementia. It's important to know that dementia can often be masked by other conditions. One of the most common is depression, especially in older adults. Depression can mimic dementia because people with it often appear forgetful, not because their memory is failing, but because they simply stop caring whether they remember things or not. They lose interest in conversation, their mood declines, and they may stop taking care of themselves because they don't care. They do this not out of confusion, but out of apathy. They just don't want to move, speak, or do something. But depression itself can lead to dementia too, over time. That's why it's so important to detect it, especially in older age. I'll make a video on how to detect depression, so don't forget to subscribe. Other conditions can also look like dementia, including thyroid disorders, chronic inflammation, inflammatory diseases of the brain, brain tumors, and even vitamin B deficiencies. Because these conditions overlap, it's very easy to mistake one for another. So if you suspect that your memory or thinking isn't working quite right, or you are worried about a loved one, the first step is to see a doctor. A good doctor will listen carefully to your symptoms and order the necessary test. Typically, that includes MRI scans, blood and urine tests for inflammation or some metabolic diseases, and sometimes thyroid hormone panels or tests for vitamin B deficiencies. If no underlying medical issues are found, your doctor will likely refer you to a neurologist who specializes in vascular dementia, stroke-related damage, and movement disorders. And maybe to a psychiatrist who can run cognitive tests to confirm whether it's truly dementia or maybe depression or another mental health condition. And remember, no doctor can diagnose dementia without proper testing, no matter your age, 60, 80, or even 100. Dementia is not a natural part of aging, it's a disease. And there is nothing shameful about seeking some help. Getting the right diagnosis is the first and most important step toward treatment and quality of life. One more time, it could be depression. And there is absolutely nothing wrong with seeing a psychiatrist. They are just a doctor like any other. If your kidneys hurt, you see a nephrologist. If your heart hurts, you go to a cardiologist. And if your brain hurts, yes, that happens too. It's an organ like any other. You go to a psychiatrist to help it heal. The earlier you start treatment and the sooner you get a proper diagnosis, the longer you can delay the severe stages of dementia. The right therapy can reduce symptoms and significantly improve quality of life. And now, as I promised, here's a short self-check test that you can do yourself or ask a loved one to complete, especially if you are concerned about their memory or cognitive health. All you need is a piece of paper and a pen. I'm going to say 3 words that you need to remember. Don't write them down. Just keep them in mind. Then I'll give you a small task to complete. Are you ready? The 3 words are a duck, a table, a girl. Again, a duck, a table, a girl. Now please take your piece of paper and draw a clock, a full clock face with all the numbers, and make sure the clock hands show the time as 2:30. You have for this 30 seconds. Your time starts now. Done? Alright, now can you recall the 3 words I asked you to remember at the beginning? If you were able to remember the 3 words and draw a normal, correct clock, then everything is fine with you. A person with dementia typically won't remember the words, and their clock drawing will look very different. Numbers may be missing, grouped on one side, jumbled together, or they might even add extra numbers like 13, 14, or 15, etc. This test is a quick check to see if you need to see a doctor, or if your forgetfulness is simply due to fatigue, stress, or lack of sleep. If the result of the test is not so good, you can rest a little bit, come again to this video, and make this test one more time. It's okay. Even though it's still not fully clear what triggers the disease, there is data showing risk factors and things that may protect us. In a previous video, I discussed ways to lower the risk of dementia. These aren't the only strategies, though. If you want to protect your brain, maintain a sharp mind, and preserve memory for as long as possible, make sure to subscribe to the channel, because I will share everything you need to know in upcoming videos. Know yourself, recognize the diseases, don't fear them, and stay healthy. See you in the next videos.